question is, what services are included in intensive care daily rates? So it's a very important question because I have seen a number of billing sheets that were provided when people signed up to ClaimLogic that had item numbers on it, which are specifically excluded as part of the intensive care daily item numbers. So the 13870, 13873, which is the daily management in intensive care. The explanatory notes in the MBS schedule specifically mention item 13839, which is arterial puncture for blood gas analysis, which cannot be claimed because this is sort of deemed part of routine intensive care management. Now, having said that, if that item is or that service is performed on a patient that's not in the intensive care unit, so if you end up seeing a patient on a ward as part of a consultation and you do a blood gas, that is a valid item to claim, but it certainly cannot be co-claimed with intensive care services. The other item that I frequently see and that people ask about is ECG monitoring or interpreting 12-lead ECGs, really, because there isn't an item number specifically for ECG monitoring. So continuous ECG monitoring or electrocardiographic monitoring is part of intensive care services provided. And in terms of the ECG interpretation for a 12-lead ECG, there are a number of issues with claiming that item number. Firstly, there are 4 item numbers that relate to that, and 3 out of those 4 are really for outpatient services, so they cannot be claimed for in-hospital services at all. And 1 item number, the 11705, is an in-hospital item number, but it's a referred service, so it's an item that can only be performed if it's been requested by a separate clinician, and it's usually just for the interpretation of the 12-lead ECG, and usually the performing clinician doesn't have any other involvement with the patient, and this is again quite clearly specified in the explanatory notes. So it would be very difficult to see how this item could be claimed as part of intensive care management when the intensivist is already looking after the patient. I mean, I guess under very rare circumstances, it could be possible that an intensivist would be seeing or would be asked to interpret a 12-lead ECG for a patient that's a ward patient or that's located somewhere else in the hospital. But I think this would be a rarity, and you would still have to keep in mind that you need a formal referral and you need a formal report that then goes back to the referring practitioners. So in general, ECGs and taking blood for blood gas analysis would be excluded. And the other big group of items that are included in daily management is all the way it's worded is all the attendances on the patient. So this means that you cannot claim any other consultation, emergency attendance, so the 160, 161 items, even if you get called back, even if you see the patient in the middle of the night, even if you spend several hours with them, the 13870 or 13873 item numbers cover all of those.